Hi everyone, welcome to another webisode of The Good Doctor on EasyLiving.com. In a previous webisode, we talked about scoliosis, and we're going to continue on this conversation with Dr. Walaa. Treatment. What are the options available for someone who's now been detected with scoliosis?
Actually, I'd like to say that everyone is different. So, because like everyone hear about someone had surgery, or had a brace, or had physio, or had nothing, everybody is different. So what we do first, we identify the age, the degrees, the cause, and based on a lot of factors from the history and the examination, then we decide. Fortunately, the majority are having very minor curves. And most of them, they wouldn't need even anything. If I'm having a 10, 15 degrees curve and I'm already skeletally mature, I'm 18, 19 years old and above, I wouldn't really need to follow that curve. If I'm having a very minor curve and the child is still growing, then we might need to have a look, which we call observation, just to keep an eye on him and have a look at the curve after 1 year. A more severe curve, which I would say till like 25 degrees, we like to keep them flexible. So in the last couple of years, there have been a lot of new researches coming out on the value for physiotherapy and exercise and how it's important to keep the range of movement and the flexibility of the spine as much as we can. Even if you're having a small curve, you want to be flexible. You don't want the kid to be having a stiff spine as well. One other method we use in treatment of scoliosis as well is the bracing that we use to hold the spine in a more correctable position. A lot of parents, they come and ask about bracing, but like I have to say, there are very strict indications on when to use bracing. You have to have like a certain causes, types of curve, and the degree of curve. Like usually, the recommendation is to use it on those who are having a curve between 25 to 40 degrees, and at special time where they are not very young and not too old or mature, because there is no point of doing it. Another very important point about bracing, it is a strong commitment. So we have to discuss, if we choose a treatment with the family and the child, we have to discuss it thoroughly, because it's a very big commitment. The child has to wear it 18 to 22 hours a day. That means she has to go with it to school, has to go out, it's almost wearing it all the time. And if we're not committed, then there is no point of doing it. So that's why it has to share the child in the decision of using it.
You talked about 18 to 22 hours.
Yeah.
For how long a period?
Usually, in most of the child, it goes from around 1.5 to 2 years. On average, I would say.
Perfect. These are the non-surgical procedures and options, or some of the common ones that's available. And in the next webisode, we're going to talk about the surgical procedure. Thank you very much for this insightful information, Doctor. For all of our viewers, if you've got any thoughts, comments, please leave them in the comment section down below, and we'll definitely respond to your questions. Thanks for watching The Good Doctor on EasyLiving.com, where you can find anything and everything lifestyle.